Thanks for joining us. I'm Judy Simpson. Our focus today is on your health. We'll be looking at lung cancer. In the time it takes to watch this program, 3 Americans will die from the disease. Despite startling statistics about lung cancer, there is a new screening campaign that could help save thousands of lives every year. To learn more, we've called on Dr. Garth Garrison and Rebecca Ryan. Dr. Garrison is a pulmonologist at the UVM Medical Center and the director of the university's lung cancer transdisciplinary team. Rebecca is with the American Lung Association in Vermont, where she serves as the Senior Director of Health, Education, and Public Policy. Thanks so much, both of you, for coming in. Dr. Garrison, what are some of the reasons why lung cancer should be more widely talked about?
So it's surprising to most people to hear how common lung cancer actually is. So in Vermont, cancer is actually the leading cause of death, and lung cancer is the leading cause of cancer-related death. So every year we have at least 500 new cases of lung cancer and over 350 lung cancer-related deaths. And it's something that's just sort of less well understood in the community how common this actually is.
And this is for both men and women?
For both men and women.
And it's also one of the lowest 5-year survival rates of all cancer types.
Yeah, of all the sort of major cancer types, lung cancer generally comes with a pretty poor prognosis, with only about 18% of people who are alive at 5 years. And part of this has to do with the fact that most people who are diagnosed with lung cancer are diagnosed when it's already advanced and less and more difficult to treat.
And here's some statistics too. It says it's estimated that there will be 510 new lung cancer diagnoses in Vermont this year alone. Mm-hmm. That's incredible.
Yeah.
And in 2015, there were 350 Vermont residents who died from lung cancer. And nationally, lung cancer kills 426 people every day. Mm-hmm. That's very sobering.
Yeah.
And so what are some of the symptoms of lung cancer?
So lung cancer is tricky. So an early stage lung cancer, may be the size of a grape, and you think of how big that is compared to the size of your lungs. Many early stage lung cancers don't have symptoms. Occasionally people with lung cancer may experience cough, shortness of breath, coughing up blood, unexplained weight loss, unexplained wheezing. The symptoms can be kind of nonspecific, can be attributed to colds or infections, and so that's one of the reasons that we have difficulty diagnosing it early. Mm-hmm.
And so if you have those symptoms, should you talk to your doctor about it?
Oh yeah, I think especially if you're someone who's at risk for lung cancer, so a history of smoking, family history of lung cancer, if you've got any sort of respiratory related symptoms that are unexplained, that are going on, a cough or a cold that's going on longer than you think it should be, definitely checking in with a medical professional is warranted.
Well, so what's the prognosis for someone diagnosed with lung cancer?
So overall, the survival rate is about 18% at 5 years, but it's very different depending on the stage at which it's diagnosed. So in sort of the lung cancer screening detected patients, the survival of the early stage lung cancers is upwards of 90% at 5 years. So the survival improves dramatically as you catch it earlier and earlier.
Now, some other cancers, they have a screening program for that. You're told to get, a pap smear, you're told to get colonoscopy, but is there a screening for lung cancer?
So screening for lung cancer only became available recently, and that's because of some advances in technology to do CAT scans very quickly and at lower radiation doses. They've been looking at doing lung cancer screening since at least the 1960s with chest x-rays and sputum tests, and nothing was really proven to be effective until we had a very large trial that was done and published in 2011 that showed that annual screening with CT scans in high-risk people could catch cancer earlier and dramatically reduce the number of people who die from the disease.
So who's eligible to get this screening, or what would be the process?
So the people who were identified as high risk in that study were people who were age 55 to 80, who had smoked at least 1 pack per day for 30 years or the equivalent, and who were actively smoking or quit within the last 15 years. That's a particularly high risk group. And on the basis of that trial where the benefit was shown, that's the group of people that it's currently recommended for. There are other people who might be high risk and other societies might have recommended screening for. So if you've had a lot of asbestos exposure, if you've got a family history, there are some conversations that can be had with a medical professional about lung cancer screening. But the main group of people are those in the first group I mentioned.
So if someone's considered high risk, if someone's watching this at home and they're like, that's me, what should they do?
Start talking to your primary care provider. So this is something that's widely available. It's covered by most insurances. It's covered by Medicare. It's covered by Medicaid. So if you're in that high risk group, it can be handled just like any other screening test. So like a mammogram or a colon cancer screening, they can order that test and it can be done at several facilities throughout the state.
And what does the test entail? I've never had a CT scan, so I don't know.
So these CAT scans are done without IV contrast, so you don't have to have any pokes. You go into a scanner, you hold your breath, and the scan is done in 10 or 15 minutes. There's sort of a check-in process, a registration process. So you're probably there for a half hour or so, but it's a pretty quick scan. They do it in a single breath hold and get all that information in just a matter of minutes.
Amazing. And so are the majority of lung cancer cases found in people who have smoked or are smoking?
In the United States, about 85% of lung cancers are tied to cigarette smoking. There are a number of other risk factors that can add to that, can increase your risk, or can help explain some of the people who are diagnosed without smoking. So radon is a big one, is thought to be the second leading cause of lung cancer in the United States. Asbestos exposure, especially around here, a lot of people have exposure to asbestos or other sort of inhaled toxins. So, but those are the radon and asbestos exposure are going to be the next two biggest concerning exposures.
And what do you hear from people who say, wait a second, I quit smoking 15, 20 years ago, so this wouldn't happen?
Yeah, so when you stop smoking, your risk of lung cancer starts going down dramatically. So compared to ongoing smoking, stopping smoking at any point, your risk does start to go down. But there's, with prolonged smoking, there's some damage that may have been done to the lung that will present ongoing risk moving forward. And so even if you quit 15 years ago, there is some increased risk of lung cancer. And so being attuned to that, being attuned to your body, seeing if you fit for lung cancer screening is important.
And so, Rebecca, are women or men impacted more by lung cancer?
Women are definitely impacted more by lung cancer. And in fact, in the last 39 years, the rate of diagnosis of lung cancer among men has fallen 32%, but increased for women by 94%. So it's really scary and startling. I think most frightening is half of all women diagnosed with lung cancer won't survive their first year. And that sort of points back to it's really important for early detection.
But that's hard to do, though. That's the sort of catch-22. And so, is lung cancer preventable?
Well, certainly with the biggest risk factor being smoking, stopping smoking is definitely the best way to prevent lung cancer. And if you're working around asbestos, obviously using precautions and avoiding exposures, getting your house tested for radon and mitigating it if there's elevated radon is really important.
Right, and we should mention too that our health department will give those kits to you for free.
Yeah, the Vermont Department of Health, if you go to their website, you can order a kit online to test your house for radon.
So basically, it sounds like if you have lungs, you can get lung cancer. I mean, it's not funny, but I mean, it's that.
Yeah, lung cancer, even non-smoking related lung cancer, is still very common, and so we see a number of people at the medical center where they've had no history of smoking and are diagnosed with lung cancer. So it is still something that anyone could be at risk for, and certainly other things increase your risk dramatically. But I think if you have concerning symptoms, especially cough that's going on and that's unexplained, or coughing up blood, regardless of your smoking history, those are things that you should mention to your medical professional.
And Rebecca, what's the American Lung Association doing to get more awareness out about this disease?
Well, in 2014, we launched a national campaign called Lung Force, and it's a multi-pronged approach to raising awareness of lung cancer. It has 3 priorities. One is to make lung cancer something people care about and act on. 2, to educate and empower healthcare professionals and patients and their caregivers. And 3 is to raise funding for lung cancer research. So besides advocating for increased federal funds for lung cancer research, the American Lung Association, thanks to many generous donors, gives awards and grants to researchers for a variety of lung cancer research projects. But we awarded $6.64 million this past year. And of all the projects, 26 are looking at lung cancer.
Is that one of the issues, Doctor, that so many cancers have been so successful in getting the publicity out and getting grant money and so forth for tests, that this really need to get on the board with this?
Yeah, lung cancer advocacy is really kind of in its infancy right now. Other cancers have been had much stronger advocacy groups that are promoting awareness, and we're really trying to work on that for lung cancer because it is a lot more common than people realize, and so Lung Force has been a really great piece of that.
Rebecca, what is SavedByTheScan.org?
SavedByTheScan.org was a national campaign that we developed with the Ad Council, and it points back to the low-dose CT screening is the best way for early detection for that high-risk population. So we're trying to raise awareness about early detection and also encourage people in that high-risk group to go to SavedByTheScreen.org and take the quiz to see if they are possibly eligible for lung cancer screening. And what we recommend people do with that then is to take that information to their physician and talk to them about a potential screening.
Well, if someone has a loved one who was recently diagnosed, do you have resources available to help educate folks?
We do. You can start with 1-800-LUNG-USA. You can call that and talk to real people, registered nurses and respiratory therapists who can answer any questions about any sort of lung disease. And then secondly, we are offering our Lung Force Expo. Dr. Garrison's one of our speakers, and it's quite unusual because it's for both patients and caregivers and healthcare professionals, and they'll learn the latest treatments, resources, and research. And that's next May 8th in South Burlington.
And are there steps that Vermont can take as a state to reduce the impacts of lung cancer?
There are a number of things the state can do, and they are doing quite a bit within the state cancer plan. But in terms of policy, really making sure that the comprehensive tobacco control program is well funded to prevent kids from starting to smoke,
right,
and to encourage smokers to quit. Making sure that the 802 Quits resources there and available for smokers, including free nicotine replacement patches. And then a top priority for the American Lung Association of Vermont next year is to urge the legislature to require radon testing in all K through 12 schools. This is for a kids' health issue, but it's also school staff that spend decades teaching and working in schools where the levels of radon may be above the EPA action level.
I hadn't even thought of that. What about workplaces? Do you think there'll be a time when that will be required?
I hope so. There are no laws right now in Vermont that require radon testing in any buildings, including homes. So we think it's really important. You can't smell it, you can't taste it, you can't see it. The only way to know if you're being exposed to a carcinogen is to test.
And once again, Dr. Garrison, can you go over some of the statistics for lung cancer as far as how prevalent it is?
So again, lung cancer is the number one cause of cancer-related death in Vermont, and cancer overall is the leading cause of death in Vermont. So 500 people per year over that diagnosed with lung cancer in Vermont, over 350 people dying from lung cancer in Vermont. The rate of lung cancer in Vermont is actually higher than the national average. So very common and a big problem in the state.
And so start the conversation with your doctor if you are in the high-risk category, meaning you've ever smoked.
I think if you've ever smoked, it's always in the conversation. If you're age 55 to 80, if you smoked for 30 years or more and are actively smoking or have quit in the last 15 years, then that high-risk group, you should be talking to them about whether or not lung cancer screening is right for you.
Mm-hmm. And Rebecca, again, if you can give folks that information where they can get more information about lung cancer.
You can call 1-800-LUNG-USA. You can go to our website, lung.org, and that will direct you to Saved by the Scan as well.
Mm-hmm. And also, too, we should mention that, once again, the health department, the Vermont Health Department, will give away free radon kits.
Yes. Yeah.
All right. Any parting advice for folks who've watched this and maybe you're a little upset or worried?
Yeah. Well, I think chances are you don't have lung cancer, even if you're in the high-risk group. But I think it's something to keep in mind, and medical professionals are very in tune to this now. There's been a big effort to get the word out, and I think if you've got any concerns, definitely talk with your medical professional. We've got a lung cancer screening clinic at the University of Vermont where we can talk to people who have concerns as well. I think it's always worth having a conversation about your risks and whether or not these tests are a benefit to you.
Well, I want to thank you both for coming on and joining us and talking about this really important issue. That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.